Part of the reason why chronic butt pain is because nobody's been able to figure out for the person yet. Chronic pain means it hasn't been able to be fixed yet. So we're going to do a whole series of videos going after individual nerves in the butt and the history points and the tests that you're going to do, palpating the tissue, treating the tissue, and then retesting that thing to see if you get real-time results within the treatment visit so that you're getting your patients better. Starting with butt pain, because it is probably the most common the most common location of pain in the entire body. Everybody and their mother has some form of low back pain or sciatica, and so just because it's the butt pain doesn't mean it's actually coming from the sciatic nerve. We have to figure out what it is. We're going to start this with the superior cluneal nerves because it's the thing that's the highest of the butt on top, and we're going to just talk about it a little bit. So first, as far as location goes, it's typically going to be the upper butt area of the low back, right in this area, because that's where the superior cluneal nerves live. Here is a little chart where this is Wikipedia. You can search superior cluneal nerves. This is the front of the hip. This is the back of the hip. This yellow area is where a superior cluneal nerve entrapment will typically cause local symptoms in that area. So location matters enormously when you're trying to diagnose somebody and get them better. There are 5 other nerves that can be entrapped and cause butt symptoms according to that chart. And that's not even talking about the superior and inferior gluteal nerves, the inferior gluteal nerves, so on and so forth. Any nerve that's entrapped can cause local symptoms somewhere nearby where it lives. Typically, from a provocative standpoint, they should be able to touch their toes. It's going to lengthen the cluneal nerves, but what's going to be even worse is we call it the shoe tying test, where they're going to tie their shoe because this moving back of the hip creates a lot of lengthening right where their superior cluneal nerves come through the iliac crest. They go through a little tunnel and go on top of the gluteus maximus, and that's commonly where they'll be stuck. Just so you can visualize what those cluneal nerves look like, these 3 little nerves here coming from L1 to L3 are the superior cluneal nerves. They come from L1 to L3. They come from underneath multifidus longissimus, come out here. Iliocostalis is on top, but they come through iliocostalis, through the thoracolumbar fascia. You can see it on this side, and they come out right on top of superior of the gluteus maximus. And then they can be stuck anywhere. A nerve can be stuck anywhere. It can be stuck anywhere here, but very commonly it will be stuck as it comes through the tunnel on the iliac crest, and then it comes on glute max. So what we're going to do now is we're going to assume that Casey has the provocative for that shoe tying test.
I feel tightness right here.
Okay, so she has some tightness right here. We're going to assume that she has actual pain along the iliac crest or below, and she can touch her toes fine, because that's what a superior cluneal nerve entrapment will look like most of the time. Go ahead and line your side and face James. So if I find the PSIS here, now I'm looking for a nerve that comes across like this. Here's the PSIS. Okay, here's one of them. Here's one. Here's another one. Here's the last one. And it goes down. This is typically the area I check. Her iliac crest is right here. Her PSIS is right there. These are the superior cluneal nerves. When you're just starting to feel nerves, typically when people get instruction within the first training that I ever do with them, they're able to own feeling the nerves because they just get guidance and we can guide them what it feels like. But it's harder if you're not with an instructor or somebody who knows how to feel it. So what you need to do is go in these areas and you need to very slowly and softly sync where you think that the nerve lives. And then when you're sinking down, what you're trying to feel for is a hard, dense noodle going in the direction that the superior cluneal nerve lives. What we would do when you're with us is Casey knows what nerves feel like, and she would say, yes, you're on it, no, you're not on it. And then she would help you get further on it because she knows what nerves feel like, and this is what we do for each other when we're training. But since you're alone, you're just going to have to play for 20 minutes, 40 minutes, an hour at a time, and take it very slow and sink onto tissue and ask yourself, does this feel like a dense, mostly cooked noodle that is going in that direction that I can hang my hat on and I'm certain that I'm on it? And you're just going to have to get reps doing that. Because that's step one, is you being able to feel nerves and trace nerves. After you are comfortable in owning that you feel a nerve, then you can start checking if it's irritated or swollen, if it's entrapped and it's not bowing, or if it's healthy and it is bowing. So when I say bowing, what I mean is this nerve down here, I'm getting my finger right next to it and now I'm pushing it this way and it's moving. You can see that I'm moving her skin. The tissue's moving underneath. Now right here, this is stuck. It's not moving that direction when I bow against that nerve. So this is an entrapped nerve in her superior cluneal nerve. And how does it feel?
Man, it feels burning when you poke on it.
It feels burning. Nerves typically burn. So I just identified that this is an entrapment site that, and again, she said she has tightness here. So we'll see if this tightness gets better because I release this superior cluneal nerve entrapment right there. Slide forward towards James a little bit. In order to treat this superior cluneal nerve, she's going to lay on her side. The assistant's going to be here. If you don't have an assistant, you're just going to have the patient move actively on their own into hip flexion. It's not ideal. You will get less effective treatment. However, I trained for 8 years without an assistant when I first started doing this adhesion work, and this is how you start, and you're going to develop your hands. As time goes by and you get better with this, you get better results, you start raising your rates, then you start having an assistant work with you because it's going to make you more effective. So if the entrapment site is right here, it's not bowing that way, I'm going to sink my finger in this way. So I'm taking my depth like this. And I'm taking my depth until I can cleanly feel the noodle butting up against my finger, and it's pushing my finger back that way. We call that pushback. A really bad entrapment will have a lot of pushback in a very short distance. So I'm here, I'm using my piezoform over my thumb, and I'm taking my depth. My tension set is going to be about that way. So I'm taking depth like this, I'm taking my tension set this way. Because I want the nerve, when it's stretched around my finger, to fulcrum around my finger so I tear whatever adhesion or glue is in the way. So here, this thumb is mostly soft, this thumb's a little bit flexed, but maybe 2 or 3 pounds of contraction in my hand. My piezoform's taking most of my depth. Here's my depth. My tension set. I'm having to go a little bit deep to create a tension set so it grabs. Go ahead, James. And now I'm using my body weight to create tension towards her head. And there's a lot of tension and a lot of pulling, which is exactly what we want. If you don't feel tension, you don't have effective treatment. Good. So that was a pass. And it's pretty nasty. It's pretty badly stuck right here. So I'm going to do another pass. I'm doing about 1/2 inch higher though now. Go ahead. And this spot is worse because it's pulling tighter faster than it did on that first pass. My elbow's isometric. I'm leaning my body weight as James is flexing her hip. Good. And then as always, I do a pass and I recheck. So now this is softer. She's got some stuff in the deep glute max here, or excuse me, deep glute med. But that's okay. We're going to check that test. Come on up and tie your shoe. We're going to see if the tightness got any better.
Oh yeah, it's a lot better.
Be honest.
I swear. I was able to push into it and feel it more, and now I'm pushing into it. I only feel like a 1. It was like a 6.
Was it 6 before and I was a 1?
Mm-hmm.
Okay, cool.
This
I didn't
was-
want her to be dishonest for the camera because this is supposed to be legit. She wants more treatment, that's why she's just going. So, but this is a start because Adhesion Release Methods has these 6 steps. You take this long history and you're going through your exam procedures and you're thinking through what's going on. I'm trying to shorten it because people are following our content anyway and they're just doing the treatment protocols they see. And I'm trying to give you a little bit more information. You have the history now, you have the provocative test, you have the locations, you have some of the anatomy for the nerves that get stuck at the superior glute, what you're feeling for, what the treatment looks like. And now you have a data point that you can clean these superior cluneal nerve entrapments in your office. And look, people with disc problems and they're inflamed, you release these superior cluneal nerves, their discs will often calm and relax and breathe more when the cluneal nerves aren't stuck and entrapped. So they might not even have a primary superior cluneal nerve issue, they might have a disc problem, and you release this stuff and their disc will recover better and faster than if this nerve entrapment were there. So have fun working with this superior cluneal nerve entrapment, and make sure that you comment below or DM us on Instagram and let us know how this goes, because we're making these videos so that you get better results with your chronic butt pain patients that you have. And if we can help you in any more or point you in the right direction, we're going to make more of these videos. We will be happy to help you. So have fun, and again, let us know how it goes.